Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Olivia Lemon. Today's topic is hip replacements. What are the components of a hip replacement implant?
The first is the acetabular component, which is the round socket that goes into the bone. It usually has a plastic liner to it. The other component is the femoral component, which is what goes inside the femur bone, and that typically has the ball that's associated with it. They're actually held together just by the tension of the muscles and the ligaments surrounding the hip.
What is an implant made of?
The socket and the femoral stem, the part that goes inside the femur bone, is a titanium alloy, and the head, or the ball, is either cobalt chrome or ceramic.
What is the difference between a cemented and a press-fit implant?
A press-fit implant is one that goes into the bone directly and has a porous surface or kind of gritty surface that the bone actually can grow into. A cemented hip replacement is one that uses a special bone cement to kind of fill the gap between the bone and the implant.
Can people with metal allergies get a hip replacement?
If people have a nickel allergy, a lot of times we will use the ceramic heads on those patients rather than the metal heads. But the actual titanium alloy that's used in the implants is relatively inert. The body doesn't really react against it much.